Mclaren has announced that they will be shutting down their psychiatry unit next month. I'm your Holt neighborhood reporter, Sarah Polis, asking someone in local mental health what impact this could have on our neighbors. First off, in general, what is a psychiatry unit at a hospital? I asked Michigan State University's chairman of the Department of Psychiatry, Dr. Jed Magan.
People get admitted to that unit and they have often either dementia or depression or other pretty severe behavioral disorders, and the unit can stabilize them.
Magan tells me that in general, before being admitted to a psychiatry unit, someone often starts in therapy. But he says sometimes people need a higher level of help. With Mclaren Psychiatry unit set to close, he says if patients come to an ER with severe depression or threats of self-harm, the staff will transfer the patient to a different hospital that still has a unit, which he says could cause further issues.
Wherever you go, they're not going to be as familiar with the resources in your community and so on.
I wanted to see what other services in my neighborhood are available for neighbors, so I headed over to Tri-County Community Mental Health. Sarah Lurie is the Chief Executive Officer and tells me they urge neighbors to contact them if they're in a crisis.
Everyone can call our access department and they will talk with them about their situation. And if they'd like to access services through us, then they will help them get started with that.
Though there is no inpatient care at the Community Mental Health Center, they can direct neighbors to other facilities, and they're set to offer one in the future.
Coming in March 2026, we will have a crisis care facility.
If you or someone you know is struggling with mental health, I've listed resources in my story on fox47news.com. In Holt, Sarah Polis, Fox 47 News.